Healthcare Settings, Potential Job Sites, Part 2. An alternative means of providing primary health care is the free clinics. These are designed for people that are unable to afford traditional healthcare services or the ones that are reluctant to use the more traditional services. They are as free from red tape as possible, but not completely. And often these clinics are established by the local public health agency to meet the needs of the community that they are serving. Rehabilitation occurs after a patient has been stabilized following an acute illness or injury or surgery. The rehabilitation phase can last from days to years, and it focuses on the return of function and the prevention of further disability. Now, the return of function, we have to realize, may not be to the level that they were at before, but it should be focused on to their optimal level, or the level where they can independently take care of themselves again, if at all possible. It can take place in rehabilitation centers, long-term care facilities, outpatient facilities, group residential homes, the patient's home. And nurses play an important part in rehab services. In skilled nursing care, the services of trained professionals that are needed for a limited period of time following an injury or illness include services of trained professionals such as an RN doing wound care, in changing dressings after a major surgery, or administering or monitoring IV antibiotics for a severe infection. A physical therapist that helps correct strength and balance problems that have made it difficult for a patient to walk or to get on and off the bed, toilet, or furniture. A speech therapist that helps a person regain the ability to communicate or swallow after a stroke. An occupational therapist that helps a person relearn independent self-care in areas like dressing, grooming, and eating. Skilled care can also be needed on a long-term basis if a resident requires injections, ventilation, or other treatment of that nature. A skilled nursing facility placement criteria are patients that cannot take care of themselves because of physical, emotion, or mental problems. Patients that can no longer care for their own personal needs, such as eating, bathing, using the toilet, moving around, or taking medications. They might require more care than can be provided by their caregiver, or they're not able to live alone. There are patients that might wander away if they're unsupervised. They might have an extensive medical need that requires daily attention or monitoring by a registered nurse that is supervised by a doctor. Possibly they're going to be discharged from the hospital and they require skilled nursing care or rehab before they're able to return home or back to a residential facility. And they have to be recommended for a nursing home by a physician. People who are able to recover from a disabling injury or illness may temporarily need the custodial care while they're getting back the strength and balance to be independent again. For people who are losing their ability to function independently due to a chronic disease and increasing frailty, custodial care might be a long-term need. But in the most severe cases where a person is bedbound, ongoing supervision by a registered nurse is necessary along with the custodial care to make sure that proper hydration and nutrition and skin breakdown prevention measures, etc., are in place. If a custodial care resident becomes ill or injured, they might need to spend a period of time in skilled care, and then they return to their custodial care. Whether a resident is under skilled or custodial care is important in terms of who provides the care and who pays for the services that are provided. Custodial or personal care can include assistance with their ADLs, such as bathing, dressing, eating, grooming, getting in and out of bed, just ambulation, toileting, or incontinence care. And it can be provided in their home, in a long-term care unit or skilled nursing unit, etc. Long-term care is a variety of services and support that is designed to meet health or personal care needs over an extended period of time. Most long-term care is non-skilled personal care assistance, such as help performing everyday ADLs. Might help people with disabilities or chronic care needs, promote independence, help them maintain function, support their autonomy. The goal of long-term care services is to help maximize independence and functioning at a time when the client is unable to be fully dependent. Nursing homes might be skilled nursing facilities also. These are facilities that have a 24-hour medical care available. They include short-term rehab, such as physical therapy, as well as long-term care for people that have chronic ailments or disabilities that require the daily attention of a registered nurse, in addition to help with personal care such as bathing, dressing, or getting around. They specialize in short-term or acute care, intermediate care, and long-term skilled nursing care. The length of stay and level of care might vary. In the skilled nursing facility, they have 24-hour-a-day care, and the care is paid for privately by health insurance, by Medicaid, and by Medicare. In-home care, there are several different varieties. We have independent living. This is designed for healthy seniors that are self-sufficient, but they want the freedom and privacy of their own separate, easy-to-maintain apartment or house, along with the security, comfort, and social activities from a senior community. They really don't require personal or medical care, but they like to live with people their own age that share like interests. There's board or care homes that are state licensed assisted living for people who need minimal assistance with their personal care, such as their ADLs, but who also need or want communal meals and easy access to social contact with their peers. They can also provide assistance with facilitating self-administration of meds and transportation. And enriched housing is similar to adult homes, except the seniors live in individual housing units. Retirement or assisted care. We have two different types here. We've got the assisted living program, which emphasizes a resident's privacy and choices. These residents typically have private locking rooms and bathrooms. There's numerous kinds of housing with services for people who do not have severe medical problems, but they might need a little bit of help with their personal care, such as bathing, dressing, grooming, or meal preparation. And then we have the continuous care retirement community, which provides a continuum of living options from independent living, enriched living, assisted living, and skilled nursing home, all on one campus. Residents can move from one level of care to another as their individual needs change. A complex of residences that include independent living, assisted living, and nursing home care is really what continuous care retirement community is. And this is so seniors can stay in the same general location as their housing needs do change over time, beginning when they're still healthy and active. So we look at residential care, which we see community health nursing services. This is designed to improve the health status of communities or groups of people through public education. They might screen for early detection of diseases. They provide services for people who need care outside of the acute care setting. They also might exist as part of an outpatient clinic service or a service attached to an HMO or a freestanding private service. Home health agencies provide home health services that are supervised by a licensed health professional in the patient's home. There is an increased focus on family and the patient's environment in this type of care. The purpose is to promote, maintain, or restore health and minimize the effects of illness or disability. Skilled services in the home health care can include skilled nursing, physical therapy, speech and language therapy, occupational therapy, medical social services, homemaker health aid services, and there's also other therapy services that might be offered. There's also adult daycare centers that are a possibility of a place for you to find a job. Certified nursing assistants and personal care assistants who meet state requirements assist these clients with their ADLs. Volunteers play a major role in some of the adult daycare centers. These centers provide services for individuals who need supervision because of physical or safety needs, and provide mental stimulation, socialization, again, assistance with some of their ADLs, and basic observation skills. They can include transportation, meals, therapeutic activities, nursing interventions, and rehab activities. Basically, these services are provided for people that do require some supervision, while the main healthcare person in the home goes to a job or goes on a vacation or has a day shopping, etc., and they just can't leave the individual alone. Wellness centers promote programs for wellness, and they include different programs such as nutritional counseling, exercise programs, stress reduction, weight control, and it might be some facilities such as fitness clubs or Weight Watchers, smoking cessation programs, stress control, parenting classes. All of those are some examples. End-of-life services for persons who have been certified as terminally ill may benefit from hospice or end-of-life care. The goal here is to maintain comfort as death approaches, and it can be provided in an institutional setting. It might be in a hospital, it might be a freestanding agency. For example, here in Pratt we do have the Hospice House, which is located to the north of the college, where people go for end-of-life care. Hospice care is also available to those people that wish to die in their own home. Because RNs and LPNs and home health aides, CNAs, and volunteers all staff a hospice, home care can be tailored to meet the person's individual needs. LPN skills can be utilized by a variety of agencies. Basic nursing services, if those are required, LPNs can provide that care. LPNs can provide care that is under the direct supervision of an RN. And some of the agencies, it depends on state regulations and agency policy. But LPNs provide an important role of different agencies. And some of that is teaching self-care to the patient and the family.